morning, good afternoon, and good evening to everyone who joined us today. At the beginning, in terms of the introduction, before we start with our agenda, I would like to inform everyone that in terms of accessibility, we will be using an NI and AI tool named Wordly, which translates speech into text in over 15 languages. Right now, we'll play a very short video to show you how it works, so you can try it by yourselves through following a link that will be shared in the chat of this conversation. Right now, we also will play a video that you will see.
How to use Wordly AI language interpretation as an attendee. First, click on whatever link or button your host has provided you. This will open up a tab in your browser for Wordly interpretation. As you can see, everything I'm saying is being captured and transcribed into English. We recommend resizing your browser so that it fits nicely along whatever video or slide content you have. Second, go to the language selector and choose any of 19 available languages that you would like to have the text translated into. Now, everything that's being said is being captured and translated into Japanese. If you have the right language accessibility pack, you can also listen to whatever is being said in your preferred language, simply by unmuting the speaker mic. And that's how you use Wordly translation as an attendee.
We hope that this software will help more people take part in the discussion and it will help us reach the language barrier. Another keynote that I would like to point out is that, as you truly noticed, this event is being recorded and will be made available to other participants and the public who were not able to attend today's webinar. In terms of participant interaction, we prepared a very short poll to which answers will be provided throughout the event, and we would like to encourage everyone to provide their answers in the meantime. And on top of that, we also would like to encourage you to ask any questions that you may have throughout the event in the chat of the discussion or in the Q&A session. With this, I would like to pass the floor to Scott, the president of Alpha One Foundation, who will give introductory remarks. Scott, the floor is yours.
Thank you, Kinga, and hello everyone, and welcome to this year's Alpha One Global Advocacy webinar. My name is Scott Santarella, President and CEO of Alpha One Foundation, and it's my pleasure to welcome you here today. Over the years, I've worked with many patient organizations, and one thing that has always been instrumental in achieving any goal is having the voices of patients themselves heard by policymakers. To accomplish this, patients must be prepared, and that is precisely why we have been hosting these training webinars along with our colleagues from RPP. During today's event, you will hear from Kinga and Anton from RPP, who will give an overview of the tools that you as patient advocates have at your disposal to make yourselves heard. Furthermore, we'll also hear from Dr. Frank Willersinn from Belgium's National Alpha One Patient Organization, who will present one of their most recent and successful campaigns meant to raise awareness about Alpha One. I want to stress the importance of the work that our friends in Belgium have done. Their efforts in advocacy have landed them several meetings with members of parliament and have also submitted a list of questions to their prime minister. In addition, without going into too much detail about their event, as Frank will do shortly, I want to welcome the creative spirit that they have in approaching advocacy. Their imagination and creative problem solving is the exact reason why we believe that their story is so inspiring and can act as an excellent example of how to go forward with your own advocacy efforts. With that, I will now pass the floor back to Kinga, who will give you some more details about today's agenda.
Thank you, Scott. And once more, hello everyone. My name is Kinga Buntovic, and I am Senior Consultant at RPP Brussels. We are a public affairs healthcare consultancy, which means that we specialize in policy and stakeholder communication, and we have had the privilege of working and collaborating with Alpha One Global for several years now. And this is my huge pleasure to welcome everyone to this year's edition on the Alpha One webinar on advocacy. As Scott mentioned today, we will hear from Alpha One patients from Belgium, who will speak about a most recent campaign that they organized in the heart of Brussels, The Way to Move. But this is not the only engagement we saw from the Belgian patient organization. As you may recall from the European Alpha One Awareness Day, that took place back in April, the Belgian patient organization have also been engaging with national policymakers in order to put pressure on the Belgian government to make the augmentation therapy available for all patients who need it. And for more information, I'd like to encourage everyone to watch a video they made for this particular event. During this event, we will also present the key principles when it comes to becoming a good advocate. We acknowledge that we have on this call participants with limited advocacy experience, but also we have advocacy veterans, which is a great setting, a great platform to gather best experiences, examples, interact, and encourage one another to start or continue with their advocacy efforts. Right now, we are in a situation where it's been 2 years since the outbreak of the COVID pandemic, during which plenty has changed. And regardless, healthcare still remains on top of the political agenda. And with alpha-1 patients being particularly vulnerable to respiratory and similar diseases, advocacy remains really a key pillar to ensuring their safety and well-being, not only of them, but also their families. And once more, this is a key moment to maintain the current strategy if there is any ongoing, and if not, to start engagement with policymakers. Approaches to advocacy and political outreach also had to be adapted dramatically since the start of the pandemic, and this is something that we spoke during the last year's webinar. But regardless, patient advocacy remains an important tool in communicating and calling for specific measures to be considered to indeed improve the lives of alphas. As such, this webinar we will present the updated alpha-1 advocacy pathway, which is a fantastic microsite that will support patients with starting, and if there is a current strategy, continuing the strategy, broadening your advocacy efforts, and guide you through a series of approaches that are available for you to reach the wider patient community, policy community, and also media community. With that in mind, I would like to also outline specific objectives of this today's training, namely to provide guidance on what you can do in terms of advocacy and engaging with stakeholders, including politicians both at the national and European levels, to provide you with knowledge and ideas how to conduct engagement that would grant your community additional visibility, additional opportunities, and last but not least, to provide a platform for you to discuss experiences and share the best practices. And really hope that this advocacy training will provide you with the necessary information and increase advocacy activities at the European level and also at the national level, particularly now when, as I mentioned before, healthcare is at the forefront of political discussions. We are also joined today by my colleague Anton, and we have on the line Randall and Giancarlo from Alpha-1 Global, who I'm sure that all of you know. So without further ado, let's just start with the agenda. On the screen, you shall see the agenda for this webinar. The training will compose of 3 parts. First, we'll hear from Frank, a Belgian advocate, following which I and Anton will speak about the updated advocacy pathway, which will be soon available on Alpha-1 Global website. And to make the session more interactive, as I mentioned at the beginning, there is a poll that we would like to encourage you to answer. And throughout this webinar, we'll be providing specific answers to make all the aspects more clear from your side. Then we'll have also a brief Q&A session when the panelists will be answering any questions that you may have throughout the presentation. Please note them down once more in the chat of this webinar, or put them in a Q&A section on the Zoom. Now, kicking off, first, we would like to play a video recorded by Dr. Frank Willersinn, who has been extremely engaged with advocating for to improve the lives of Alpha-1 in Belgium, and was keen on sharing information with all of you on what have been done recently in Brussels. And we hope that this may provide you with additional thoughts and potentially you may consider mirroring the approach at the national level to raise awareness of the general population about alpha-1 and rare diseases in general. Right now, we can play the video of.
So my name is Frank Willersinn. I'm an alpha-1 living in Brussels in Belgium. And in this webinar about advocacy, I thought it might be interesting to share with you a project, an event we had today, this year at the Rare Disease Day 2022 in Belgium. And our association called RADIORG is a couple organization for all rare diseases in Belgium. And Alpha-1 Plus, which is the Alpha-1 Association, patient association here in Belgium, is well represented in this National Association about Rare Diseases. And we planned to make an event on the Rare Disease Day at the end of February. Now, I will share with you some slides to show you what we did. The project was called the waiting room because we built up a waiting room with the blue box you can see here in the right hand, quite in front of the central station at the end of February for a couple of days. And the idea was, well, the idea in a waiting room was to wait. And we were waiting for a couple of people, like, for example, our Minister of Federal Health or some other people who are involved in rare diseases, not only patients, but also doctors from the hospitals and other stakeholders. So here you see it a little bit in French, because in Belgium we have French and Flemish as language. And the idea was to make a waiting room out of the central station as communication room to speak about rare diseases, to sensitize and to find people who would share our ideas. And at the same time, we're waiting for the Minister and the Secretary of State. So as a waiting room, of course, you have chairs, you have posters, you have a lot of things there. And we were working with a communication company, and this communication company, Bonka Circus, there was a script, there was a whole communication campaign. As you can see, with a lot of ideas, because we have 500,000 patients with rare diseases in Belgium and 2,500 alphas. And so in this project, we communicate with the public affairs, with the ministers and members of the parliament and experts to sensitize about rare diseases, also to sensitize about alpha-1. And so the posters in the waiting room were like this, where people are waiting really to show you, well, what are you waiting for, and to get into the discussion. And there were magazines and a press release map and all kind of elements, and also testimonials in video or printed for people who are waiting on medication for rare diseases. Other testimonials from patients in the hospital were present, and some flyers, tools like you can see, and a specific tool for a clock for a waiting room. And so, well, the project was launched in November, but realized end of February, also on the social media with an app to get some testimonials from people outside to bring them in. Like, for example, you could take a picture while you are waiting for the Minister of Health or for other people who would help you to realize and to resolve the problem you have in your social and in your situation of health. And also some influencers from the social media were present. And so we have built up this waiting room you can see on the right side, and on one side, well, of course, as you see, there was glasses, so people could look into the waiting people in this waiting room. And as it went out to the social media, but also by the press release, so a lot of people came by. Also, as I say, doctors and other stakeholders from the Ministry of Health, even from the Ministry of Economics. And it was a social event with people from Rare Disease Association, with Fernanda from Alpha One Belgium. And well, for 3.5 days, we were very active to run this waiting room. So the question is a little bit, it's difficult to figure out how many impact we had. Of course, we saw it on the social media, the number of clicks we recorded, and other ideas realized or promises of the Federal Ministry of Health, and we were quite empowered to do something like that. Also, the next year, as you can see a discussion, there was a lot of round table in the waiting room here with lawyers to speak about the rare disease situation in Belgium, which is quite complicated and very specific, like in all countries. So at the end of the event, after 3 days, here you see the crew from the Rare Disease Association Radiorg in Belgium. Well, that was an event which is, how to say, we found ourselves in this kind of approach, and just to give you an idea what can be done and how things can turn out. So thank you very much for your attention on this event. Thank you.
So this type of advocacy that was undertaken by the Belgian organization recently falls under the community presence advocacy category, which is one of 5 that is included in the updated advocacy pathway, which once more will be soon available on the global on the Alpha One global website. I just would like to take this moment to also once more thank Frank for recording this video. Frank, thank you very much. Your engagement is really very much appreciated by all Alpha One community. The Alpha One pathway that we will shortly present to you was updated to guide you in choosing the right advocacy categories, which are fit for different types of patient advocates, which can be self-advocacy, social media advocacy, community advocacy, just like the one that Frank undertook recently when organizing this waiting room campaign. Another types of advocacy are policy legislative advocacy or patient organization leader advocacy as the 5th one. Before we move to specific types of advocacy categories, I would like to point out that regardless of the type of advocacy strategies, there's one thing that is in common, which means adequate preparation. The first question that was in the poll actually asked you what are the key things to consider when it comes to any engagement. Of course, every single answer that was provided to you is to a certain extent relevant. However, key aspect that should always be considered, that should always be kept in mind, is to always first have an overarching goal of your advocacy efforts, and specific objectives, a long-term action plan, as well as specific asks that should be aimed at specific stakeholders that can support you in reaching the objectives and the goals set. A little bit more about the theory behind it, and then after that I'm going to link it to how our Belgian patient organization tackled their advocacy efforts. Starting from goals and objectives, which are absolutely essential for your advocacy efforts. Your goal should always be long desired outcome, whereas the objectives are really the steps that are needed to reach the set goal. Now, having the goal and overarching objectives, it is also recommended to always have a developed action plan that would contain first short-term objectives, but also messages that you would like to convey. Short-term objectives can support you in achieving this goal. This can be, for example, depending on advocacy strategy that we'll use. An example, a meeting with a number of politicians at regional, national, or European level and present them your objectives, your long-term goals, speak about the situation of alphas, organize an event, speak at a conference, publish a press release, engage or start a social media campaign, and so on and so forth. A credible and consistent message for your advocacy campaign is really also very, very, very important. And I would like to stress that every single message should be based on a list of facts and figures, studies and their outcomes. And it's really important because this is something that we often experience, that when it comes to referencing data. This data is often not hyperlinked, so policymakers and also other stakeholders simply struggle to verify if the message is indeed credible and reliable. Finally, based on the goal objectives, you should always have a constructive ask. Differently said, a recommendation that is aimed at a specific stakeholder with the purpose of achieving your goal. If, for example, if you're targeting a policymaker, your ask should be, for example, could you please table a parliamentary question because we would like to know what the government is doing in relation to reimbursement therapy. This is something that also our Belgian patient organization did recently. And now I'm going to speak to each of the points from the advocacy at the Belgian level. So as you know, as I mentioned before, the Belgian patient organization not only engaged through this waiting room campaign, but also engaged with policymakers at the national level. With an overarching goal to both of them, to both activities, to have equal access for alphas to therapy compared to, for example, alpha-1 patients in other countries, or to raise awareness of general population and to put pressure from the general public also on the government officials in order to improve lives of rare disease patients and alpha-1 patients in particular as well. Speaking from when it comes to short-term objectives, in order to reach this overarching goal that they have, they organized this waiting room with the goal to raise awareness about rare diseases and problems that rare disease patients face. For example, that patient have to consult 7 different specialists, specialists who do not discuss the patient's problems between one another, which outlines the lack of multidisciplinary care, or the availability of the treatment that is needed for a patient that is only available abroad, or, for example, long time spent by the patients and specialists to diagnose the disease, and so on and so forth. So this is one of the short-term objectives that they set for themselves in order to achieve this overarching goal. And the second short-term objectives is organization of various meetings with Belgian policymakers to really put the pressure on the government to make the therapy available for everyone who needs this. Now, in terms of asks and specific messaging, taking the waiting room as an example, the campaign called for the general public to sign a petition available online that called, for example, for recognizing accessible expertise, for the need to introduce a multidisciplinary consultation for any patient that is suffering from a complex or rare condition, or, for example, calling on equitable access to therapy and medications based on medical needs. And when it comes to the policymaking engagement, the clear ask to member of the Belgian government was to table a question to see what the Belgian government is doing in order to make the therapy reimbursed again for Belgian patients, because once more, even the therapy is available abroad, and patients can access it through different European policies, for example, cross-border healthcare directive. Again, it's not available for everyone at the national level. So this is the type of advocacy that they undertook, and as you can see, they ticked all of the three boxes and have great engagement with both general population as well as national policymakers. One final note I would like to make when it comes to this point is that as a patient advocate and as a patient advocate at the national level, if there is an alpha-1 national organization, every single messages that you would like to convey to policymakers or other stakeholders that you're engaging with shall always be aligned to the messages and asks that your organization is advocating for, because simply we are stronger together. Now let's start with the advocacy pathway, with the presentation of advocacy pathway. I would like to point out that regardless of your personality type, everyone can be an advocate, and this is something that we should be calling for. That everyone can really be an advocate of himself advocate for the loved ones and also for other patients. Aspects that you are most familiar with, of course, can be found helpful when it comes to establishing the type of advocacy fit for a patient. Advocates, for example, with the law background would feel more comfortable with the policy and legislative advocacy. For example, patients with a marketing background would be more familiar or more comfortable when it comes to engaging through social media. Patients who have communications backgrounds, again, community advocacy. Of course, your profession, your occupation should not dictate what type of advocacy you should go for, but it makes various aspects simply easier, if I may put it like that way. When it comes to this Alpha 1 advocacy pathway, I would also like to point out that there's also a quiz available for patients with the goal to guide them to identify the right advocacy path. So as such, patients who would be keen on engaging, they can start from there and see what advocacy type is best fit for them. Now we can start with the first out of 5 different advocacy types, self-advocacy 1. Firstly, as all of you know that are gathered today, everyone can be a self-advocate, and this is something that as a patient advocate, you know. But this is also our role to empower other patients to become advocates, to help them and their families to better understand what they're going through by educating themselves, by speaking with their doctors about their needs, about their challenges. And this is also really important to empower all patients to seek patient support at the national level, and most importantly also to join a patient registry. Every single patient advocate, once the advocacy journey starts, should also be trained, look for advice on how to tell their stories. And this is something that Pathway also provides. You will see that there are several sources that will be available on the website that can support patients in order to learn more about the disease. And there's also a webinar that was recorded several years ago that aims to guide patients on how to tell their story. And right now I'm going to pass the floor to Anton, who will speak about other advocacy categories.
Thanks, Kinga. Thanks for the introduction. Indeed, as Kinga mentioned, advocacy starts from you. Every single voice counts, and every step that you as a patient advocate take for spreading awareness, and every step that you take in advocating for your own rights is a step towards improving the quality of life for everyone. And as we live in a digital age, every person is also their own media outlet, which makes patient advocacy far more different compared to the way it was years before, and before social media became so mainstream. So social media platforms are your go-to place to begin your advocacy journey. They also serve you to familiarize yourself with the landscape, to find out who your allies are, who you can approach, what kind of organizations already exist, and who is in general active in the field, and how you can make yourself known before reaching out to stakeholders and to other relevant parties. The first thing that you should be considering as you launch your social media presence is who you're targeting and where you're targeting them. This is also one of the questions that we posed in the poll that you can still find available. But the main answer is that you should be tailoring messages according to the audience that you're looking for. For example, Facebook and Instagram are your main ways to get your story across to a more everyday audience, to other patients, to regular folk. While reaching out via LinkedIn or Twitter establishes a far more professional presence through which you can advocate in front of stakeholders like medical professionals, like clinicians, like policymakers, or like members of the industry. Establishing said network and following is the next step when doing social media advocacy. And this is something that is a long-term and pretty much permanent, never-ending project. A generally good approach is to try to connect with stakeholders you're already familiar with, and then branch out. For example, on Twitter and LinkedIn, you can do so by first following some hashtags and topics, or by joining different groups on Facebook. And this is where also the poll comes in. I see that a lot of you have marked that Facebook is the preferred mode to engage policymakers, but unfortunately, as this does not exactly represent the case, because having the general approach and across all social media channels does not exactly work. It is important, as I already mentioned, to tailor your message according to the audience. The main audience on Facebook are not policymakers. They're mainly ordinary folks who do not make the final decisions. So it is not the best idea to have a highly technical, super specific LinkedIn post that can be immediately reposted on your Facebook or Instagram profiles, because it is highly likely that your followings on Instagram and on Facebook will simply not get it. It will not ring any bells. They will not become more engaged with the topic at hand. A good rule of thumb would be to keep it serious and professional when you're communicating on Twitter and LinkedIn, and a bit more lighthearted, a bit more approachable, and a bit more general for the other platforms like Facebook and Instagram. In general, try to be more casual on Facebook and more professional on Twitter and LinkedIn. This is something that the pathway can actually help you out with. On the pathway, you can find tips for each social media platforms, for each of the social media platforms, the general do's and don'ts, and the breakdown of what you can expect when you are trying to communicate with your audience through all of these channels. Nowadays, every campaign begins online, which is exactly why a good understanding of the social media landscape is essential, and is also why it is necessary to have a strong following and a strong network that will have your back as you fight for change, as you advocate for change in front of policymakers. The main advantage of social media advocacy remains the fact that it can be done from the comfort of your own home, at your own time, and that is great for the most part. Plenty of excellent results can be achieved by being entirely confined online, and let's face it, communicating in person might not be everyone's cup of tea. Yet, for those who do feel up to the challenge, the advocacy pathway gives the opportunity to explore more ways of engaging relevant stakeholders through the lens of your own respective community. And that's exactly the other type of advocacy, community advocacy. It is a far more ambitious task, but both in terms of the hours that you have to put that you have to devote to it, as well as when it comes to the engagement that you ought to have as you seek to practice community advocacy. It is here where you bring your social media engagement and the following that you have already established by setting up your different social media channels into action. This, of course, this type of advocacy, community advocacy, has become far easier to practice at a distance and virtually, thanks to the changes to our daily lives that we were forced to integrate during the pandemic. But that is not a bad thing. In fact, some of these shifts, we believe, are here to stay. And this is evidenced by the webinar that we're having right now. But even if they're online and not in person, but especially if they're in person, organizing community events is by no means a small task. And you must be prepared for any and all eventualities. Thankfully, again, the Alpha One advocacy pathway provides a clear and concise breakdown of the main steps you should be taking as you go through becoming a full-fledged community advocate. And while you're, of course, encouraged to take a deep dive into the pathway, as it answers many of your more, concrete questions, I want to highlight several main points. First, when you're thinking about organizing an event, you must know beforehand what exactly your goals are. A simple raising awareness message won't really cut it most of the time. Instead, you have to engage stakeholders and attendees with some concrete deliverables. Here's also one of the other questions that we had in our poll, where yes, raising awareness is of course very important, and it is part of every event that you're having, but that cannot be the sole goal of your event. In fact, it has to be everything around the event, and but it cannot be the main outcome that you have from said event. When you have a specific goal in mind, you should, like for example, a call to action or the signing of a joint pledge or something like that. This is a concrete deliverable that you can look forward to, which also raises awareness around it. When you have that in mind, you should also consider what type of event would best fit it, whether a webinar like the one that we're having right now, an educational seminar in person, or again, maybe online, a gathering of different viewpoints and stakeholders who will then be invited to, for example, formulate a joint position, or maybe a fundraiser to help you out with any of your funding needs for your organization. You can find plenty of such ideas in the pathway that you're again encouraged to check out for yourselves, but what they all share is the approach that you should be taking when organizing them. Of course, no event would be complete without proper press management. And this, again, is where social media advocacy comes in and where social media engagement is important. And it is also where the social media advocates and community advocates, they come together to build one whole. Popularizing your events on social media is essential for the success of any event, both in terms of generally having a higher turnout, and both for having more success with your follow-up actions. You should use the network that you have already established through your social media presence to spread the word about the events that you're hosting, and leverage it to ensure that media outlets can also pick up the message. And while media relations are often tricky to navigate, especially when it comes to mainstream media in your region, your country, your state, whatever, you can once again look to the pathway for some clear guidelines that will help you understand the basics. And you should also not forget that it is never a bad idea to ask for advice or for help. Earlier today, we heard from Dr. Frank Willersinn about Alpha 1 Plus Belgium's most recent event, and we're certain that while that can not only serve as an inspiration for your own events, his experience in organizing it could also be instrumental for other patient advocates looking to host something similar. And of course, I should not forget to mention this, Kinga and I and RPP in general, we're always eager to help and provide guidance should you need it, and we're already just one email away should you need any assistance. Now, up next, I've already talked plenty about content, and this is because this is the most important bit. This is the most important thing that you should be thinking about. Once you have figured out your social media campaign strategy, your community advocacy approach, everything else around it, you should know exactly what you're talking about and who you're approaching this with. This is the importance of policy and legislative advocacy. You have to be aware of the policy and legislative framework that surrounds the problems that Alpha 1 patients deal with every day. The most important thing when advocating for change in front of policymakers or other stakeholders is knowing where things stand as of right now in your respective countries. For example, whether augmentation therapy qualifies for reimbursement or not. This is something that is specific from country to country. And before approaching policymakers with this issue, you have to be aware where things stand and what progress is being made on that front. And once you have established a solid grasp of the facts on the ground, you should coordinate tightly with your fellow patient advocates in the country, if there are any. Of course, you can also be building your own patient advocacy, which is something that we'll touch upon a bit later. But the most important thing is to avoid contradictory messaging. It would serve you no purpose. It would actually be to your detriment for policymakers and stakeholders to be hearing different conflicting messages from people who are technically representing the same ideas and the same cause. In terms of complexity, this is perhaps the most difficult thing to get a handle on. You must be ready to do your research to figure out exactly what you need, whom you need it from, and how you can play a role in achieving it. And that is why understanding your national policy landscape is crucial. And you must be ready with plenty of background knowledge both of alpha-1 of the disease and of the obstacles that patients face. Frankly, in this case, this should not be too much of a challenge, as these are things that that patient advocates face every day of their life. But the hard part is how you package this for policymakers, how you translate your messages into legislative change, and how you can explain these things in an easy to consume manner to policymakers. For the most part, they will be the ones doing the heavy lifting in terms of policy. Of course, they are the policymakers. They will be making the policy that you wish to see. But your role in this is not only getting them engaged in general, but to also provide them with a baseline solution that you would like to see implemented and that you would like to see incorporated into the legislative framework. This is also when our next question in the poll comes in, where you have to know that the policymakers that you're engaging with are the ones who are already working, for example, in the field of healthcare. Because politicians, if you're engaging with just popular politicians, they'll of course not be much help on highly specific topics like healthcare, neither ones from specific political groups that you might want to seek out. It is very important to find the right policymaker for your task and to explain things properly to them so they can fight for you and fight for change that will make your life easier. And once you have done all this, once you have done all your background research, and once you feel confident in understanding where things stand and what things look like, then it's finally time to approach policymakers and ask them for their support. Now, you can do this in all manner of ways. You can do this by email, by phone, ideally by both, depends on your circumstance and how far you want to go with it. But starting the conversation is important. You have to lay out your story, you have to lay out your problems, as well as the ideas for potential solutions. And this is something that must be packaged in an easy to understand manner. Now, I will not dive into details about every single thing to do as you engage with stakeholders. You can find the detailed step-by-step guide in the advocacy pathway, as well as some sample engagement letters and different methods of approaching policymakers. But the most important thing to keep in mind is that some people, those people that you're approaching, they also stand to gain from helping you. And you as citizens and their constituents are entirely in your right to ask for their support. Most importantly, and we know that this works, even in the alpha-1 family, even we already have the success stories like the one from we just saw with Dr. Frank Willersinn, or for example in Denmark. Patient advocates have made their voices heard. They have politicians on their side to help them take steps to address the issues that they're facing. Sometimes, however, more coordination is required. And while we here at RPP can provide you with support and answer many of your questions, nothing will beat having your local alpha-1 patient organization that will jointly drive your message forward. And this is something that you should work towards. And with that in mind, I would like to now again pass the floor to Kinga, who will give some background on patient organizations.
Thank you very much, Anton. So some of us present here are already leaders in their own countries, and some may actually aspire to become ones. And this is exactly why the last advocacy type patient organization training pathway was created, with a goal to guide you with the necessary steps that needed to understand what lies ahead, and also to provide you with a step-by-step manual to understand also what to be considered in terms of structural possibilities. Together with this very comprehensive manual, please always remember that Alpha-1 Global is at all times available to support you in establishing a patient organization at the national level. Starting an Alpha-1 organization or any patient organization, I always say that it's quite, please feel free to share your thoughts, but I would say that it's similar to establishing your own company. You have to keep in mind any regulations and laws, hiring an attorney, notary to help you with the legal formation. This also includes the creation of statute that would include the mission and objectives of the association. Setting up an organization also requires 3 official representatives needed to create one. For example, to fulfill the role of chairman, secretary, treasurer, and also we also understand that you may have expertise as a patient, but it's also encouraged to have more patients on board to have so-called volunteer members. It should always be kept in mind that creating an organization is a time-consuming process with many steps to be considered, just like I just mentioned. And to remember that no one can do all the work alone. To be an effective advocacy group, to change the quality of lives of alphas, you should keep in mind, patients should keep in mind to adopt a multi-stakeholder approach. Working with doctors specializing in Alpha-1 in your community, nurses, health service providers should always be kept in mind. As a leader, as a national leader, you should master all previously mentioned advocacy types. It doesn't mean that you should be one doing each one of them, but at least to be able to guide your organization members in doing so, in organizing events, in doing social media presence, in doing fundraising activities, and so on and so forth. Setting up organization is not everything, because this is the only step that will be followed by many side activities, such as organization of regular meetings, fundraising events, finding volunteers, and coordination also between the members and industry partners. You should also keep in mind that it's very important to have a branding for your organization. This is also key to when it comes to creating your national website, social media channels, which are also key when it comes to communicating externally. I just would like to point out that every single point that I just mentioned, starting from legal information, description of the job needed for the creation of the statutes, including tips on how to effectively fundraise and engage with industry partners, can be found on the launched microsite, on the pathway document. So please feel free to. Right now, we're going to put a link in the chat to a microsite, and this pathway will be soon available on Alpha-1 Global website and available for everyone. Now we are getting to the end of this presentation, and once more, please, I would like to encourage you to go on the website right now. That is in the chat of this webinar. I'm actually checking right now. Indeed, Randall, thank you very much for posting this. And I'm happy to open the Q&A session. Please, I would like to. Apologies. We have one or two slides more here. This is all of the sources that are included on the pathway on the microsite. All the materials that Alpha-1 developed in the past. Please feel free to go and see them, communicate to other patient advocates. And with this, we can just start the Q&A session. Now I'm having a look at different questions that were tabled. The first one, Scott, I see that there's a first question, and I'm going to read it right now. And if that's okay with you, I would like to encourage you to answer this. The question goes as follows. You mentioned how important it is to build a network with stakeholders and casting a wide net in order to increase support for your advocacy. But are there any limits to this, Scott? Is there a certain type of people we should be focusing on when advocating?
So, building a robust network of Alpha-1 stakeholders is integral to Alpha-1's global mission. And the more people we engage with, the more Alpha-1 gains awareness. It's important to let stakeholders know that regardless of who they are or where they live, they can have an impact on advocating for Alpha-1. The Alpha-1 pathway outlines several ways in which Alpha-1 stakeholders can get involved in the advocacy world, from starting a social media account and sharing Alpha-1 resources to starting an Alpha-1 organization in your country. So the pathway also educates stakeholders how to identify and engage with policymakers who may have important influence in policy that can improve the lives of alphas. And you just have to be confident in how you approach it. And we have all the tools, as you've mentioned today, available to you to be able to do that.
Thank you very much, Scott. Indeed, in previous slide, we outlined different sources that were developed by Alpha-1 Global in the past that have been proven successful in many campaigns that were undertaken by national patient organizations. So once more, we would like to encourage you to if you haven't had a chance to familiarize yourself with them, we would like to encourage you to do so and spread the word about their availability. A second question, Scott, if you would be kind enough to answer, we received from our participants. The question states that on several occasions we mentioned that RPP, also Alpha One, can provide necessary support when it comes to different types of advocacy. Could you please tell our participants how to get in touch with Alpha One and what kind of advice they can receive from your side?
Sure. You know, the Alpha One Foundation works with you and Anton and RPP to engage with European policymakers that have a mutual interest in moving the lives of rare disease patients forward. On many occasions, the foundation and RPP have worked together to provide support and counsel for Alpha One patients and patient organizations that are seeking to engage with policymakers to raise awareness for Alpha One or gain access to treatment, you know, in their countries. We can also provide guidance on the types of messaging that work best, ways to interact and engage policymakers, and the types of materials that policymakers need to cause change. So please reach out to Randall or Giancarlo if you have any questions or would like some guidance and advice or counsel on how you can maximize your advocacy efforts and be part of, you know, a worldwide sort of shift in how we're approaching the healthcare needs of Alpha One patients worldwide.
Thank you very much, Scott. Once more, I would like to encourage everyone to pose any question that you may have. I see that one question was already answered, is already answered live, but I would like to once more mention that the updated advocacy pathway will be soon available online, and it will be shared with all of you together with the report of this webinar. And I see that right now we also have another question. What if policymakers will not meet with you and say that government is waiting for more evidence that augmentation therapy works? Scott, if that's okay with you, I'm happy to take this question.
Yeah, that would be great. Thank you, Kinga.
No worries. Gaynor, I believe that you should still keep trying, meeting with policymakers, and the messaging that the government is waiting for more evidence that augmentation therapy works is not a good enough argument not to meet with you, because indeed there are several sources that, for example, the European Respiratory Society published the guidance in 2017 that indeed mentions that this is one of the sources that I know that our Belgian patient organization used in order to speak with Belgian policymakers. So there are several sources that are out there that you may use in order to at least meet with policymaker. But the message should be clear that there is an available therapy, and the government should do its utmost in order to make it available for patients, because why patients in the different countries can have this therapy accessible for them, and other patients who live in a different country have to travel to receive the therapy abroad. So I think this is simply just how you create a message, but the message should be clear and structured to say that therapy has to be available. Point. And if policymaker does not want to meet with you, please restructure the message. Call him, ask for a meeting. Really be as persistent as you can in order to spread the message. Again, consistency from our side. We also, as I mentioned, we work with policymakers. And getting a meeting with a policymaker is not such an easy task, but again, persistency proves always to be fruitful. So we just have to keep on going and do our utmost in order to help the lives of alphas. Okay, well, with this, I see that we are running short on time, and I think that it will be best to wrap up right now with the Q&A session. If you have additional questions, please don't hesitate to reach out to us, and we'll make sure to get back to you with answers. With that in mind, I would like to thank you all for joining us today. We hope that this webinar was useful to you and will help you in your path to becoming an excellent patient advocate. Once more, we will recall that the Advocacy Alpha, the Alpha 1 Advocacy Pathway will give you an excellent overview of all kinds of activities that you can be engaged in. And this is a perfect place to start your journey. Of course, as I mentioned, campaigning is not easy. Getting a meeting with a politician is not easy. Questions may pop up. You may need additional support in organizing your activities, meeting with policymakers. And here, this is where Alpha 1 Foundation will be of your support, and we are always ready to help you. Just don't hesitate to ask. Once again, thank you. A big thank you to all of our attendees, to Dr. Willersinn, and we hope to hear from you soon. Right now, I'm going to give the floor to Scott for concluding remarks. Scott, the floor is yours.
Thank you, Kinga and Anton, and thank you, RPP, for your support in organizing this event. I believe it was truly educational, and I hope that everyone here will take the time to go through the Alpha 1 Advocacy Pathway, which is an excellent tool to help patient advocates make their voices heard. I'd also like to thank Dr. Frank Willersinn, who gave us an excellent example of how creativity and patient advocacy come together to deliver a powerful message. And finally, and probably most importantly, I want to thank everyone who attended today's events. I'm convinced that by taking the lessons that we learned here today, each and every one of us can be a driver of change. Patients speaking up and making their voices heard is the most important aspect of awareness-raising campaigns. That is why I want to once again encourage all of you to take what you've learned today, take the advocacy pathway, and build on your experiences of others and spread awareness for Alpha 1 and fight for a better tomorrow for our community. And don't forget that you don't have to do this alone. Alpha 1 Global is here to support you in your campaign, as is RPP, who are always eager to answer any of your questions and provide any insights they can, and they're wonderful people to work with. Once again, thank you everyone who have joined us here today. Have a wonderful day, and we look forward to working with you in the future to make a difference for all patients around the globe. Have a great day and take care and be safe, everyone.